My name is Conny Cooper. I'm a practitioner of Chinese medicine. I'm based in London. I practice acupuncture and bodywork. I practice Chinese herbal medicine as well. I have been learning from Andrew Nugent-Head for just over 12 years now. I started doing the seminars, the series of seminars that he ran in London. And because I was so interested in the approach that we were learning, which was so tangible, practical, really getting results in the clinic, when the seminars were over, I decided to go on a study trip to his teaching clinic in Asheville, North Carolina, every year. And I've been doing that ever since. And it's been a real eye-opener how Chinese medicine can be used in such an effective way to work with really quite serious conditions, but achieving such great results. A big part of what I learned on the in-person courses with Andrew all those years ago was to be much more tangible in treatment, meaning that whenever we use our hands, either directly on a patient or via a needle, so doing a needle technique on a patient, we're really looking for a clear change in the chi of the patient in what we're trying to achieve. And at every moment in the treatment, we're kind of checking with ourselves, is it really happening? Or are we just putting something in and relying on more relaxation or non-specific effects? I think my patient base has changed a lot, actually. Looking back, let's say 10 years ago, I used to have a lot of patients who would come to see me and were looking for quite non-specific effects. So a big part of what they were looking for when they came to see me was to come to treatment and relax, and maybe they will get an improvement in the health from it, which would be nice, but often that wasn't even the main thing. And there's nothing wrong with working in that way. I think it's a nice way of working. But certainly I find that's what's happening these days in my clinic is much more interesting and challenging and satisfying for me, which is that I have patients who really come in because they're unwell, because they have medical conditions, and they see me much more as a medical practitioner. One student who came once, and what she said to me at the end of the day was, "Wow, Connie, your patients are all so unwell." And that was an interesting one, because I realized that, yes, we'd had a day where most of the patients who come in had been very ill, very unwell, and I was really working with them to get them back to a state of health. But I was thinking it's interesting that a student would not have seen medicine used as medicine in that way. They would have seen it to help people relax, maybe, or, for kind of more general things. But it was really interesting for her to see medicine really used as medicine for people really unwell and who needed some more serious help, let's say. I've been very involved in the profession of Chinese medicine in the UK for a few years now. In 2020, between 2020 and 2023, I was chief executive of the Register of Chinese Herbal Medicine, which is the main professional association for Chinese herbalists in the UK. And I did a lot of work there to promote our profession, to support it, to support new practitioners. For me, it is really important that we look after the generation that come after us. We've benefited so much from the generations of practitioners who came before us, and I do think we have a bit of a responsibility to make sure that we share what we know with people who come after us and try to disseminate the good knowledge that we've learned. So that is something that I really try to do now in my clinic in London. I run it with my husband, Zarig, who's also a practitioner, who's also done a lot of training with ATS. We do, for example, have observers who come and watch us. We've gained so much from observing Andrew and Julianne in the States, and we know that it may not be accessible to everybody to go to the States regularly and do observations there. So we open the doors of our practice here in London to people who would like to come and observe this way of treating and what it really looks like in clinic. So Zarig and I are very excited that starting in October this year, we're offering the full tangible acupuncture for orthopedic injuries program here in London. This is a course which has two parts. It has an online part, which is 40 hours of online lectures, where Andrew Nugent-Head will be explaining the perspective of working with musculoskeletal injuries and giving quite some details as to what are the things to look out for, what types of injuries, demonstrating treatments, How do we take the patient into account in terms of working with the qi and blood, working with the spirit, really making sure that we're giving the patient the best treatment we can give them. And then the other part will be 5 in-person weekends where we will come together at the City College of Acupuncture in London, where Zarig and I will be teaching the clinical aspects, the practical skills that are needed to do orthopedic acupuncture very effectively. So we will, on those weekends, we will be covering skills like needle technique, spiral pecking, spreading, gathering techniques, what we need to really to do with our hands in order to hold the needle so we can work in a way so we feel the muscles releasing, we feel things changing in the body that will reset the musculoskeletal system. And also hand techniques, we will be covering deep chi, traction, assessment, palpation, all this, the other skills that we need around that to give a full treatment that really takes the patient into account. The reason I really love the approach that ATS teaches for the treatment of musculoskeletal injuries is that it is a really effective way of working, and it is also fully rooted in Chinese medicine, in the Chinese classics. One of the things I've noticed over the years, because I'm quite interested in the treatment of painful condition or musculoskeletal conditions, is that there are a lot of practitioners who maybe come out of acupuncture school and feel that they haven't had a huge exposure to the actual treatment of physical injuries in that way. And they often feel that in order to become really good at it, they may need to look at different paradigms, and they may need to go into dry needling, or I know some people who've studied to be osteopaths, or to, to really look out of Chinese medicine to become good at treating this kind of injury, because I think that what they learned isn't good enough, and Chinese medicine itself isn't quite good enough. And that always saddens me quite a lot. I mean, if people are interested and want to do that, I think that's not a problem. But if people do it because they think that Chinese medicine isn't good enough, I think that that is sad, because it's absolutely not my experience. I think that if we stay within our paradigm of Chinese medicine, we absolutely have all the tools to be incredibly effective for working with musculoskeletal injuries. The main way of working with them is using the sinew channels, so the Jing Jin. That is straight from our classics, straight from a chapter 13 of the Ling Shu. We have a full description of those big muscular bands that work, that run along the body. We have a description of what conditions they're linked to, and we have great descriptions of how we can treat them. And the idea that we work where there is pain and we release them, and the treatment may be a little bit intense, but it is really going to make a difference. And that is straight from the classics. And that is such a great, great way of working in practice. What do I mean by it's effective? I mean, everybody says that what they do is effective. So it's, it's a little bit of an odd thing to say. How can we qualify that? How can we quantify it? In general, most people, when we work with this kind of treatment, will come back the following week and will tell us, wow, my condition, even if it's a condition they've had for weeks, for months, sometimes for years, their condition is, say, 40% better, 50% better, sometimes 80% better, so just from the one session. And it will have lasted. It's not a pain relief that lasts for a day or two and then comes back. It is genuine. We've genuinely reset the treatment, reset the system, so that when the pain goes, it stays gone, and it will have reset in a way that is less painful for good. And it's just really amazing to see that happen quite regularly in clinic. People give me what I call the M word. They will say, "Oh, what you did was magic," and I would say, "No, it's not magic. It's just really good, solid treatment in this way." This is what we're trying to share with other people. This is what we're teaching in this Tangible Acupuncture for Orthopedic Injuries series. So practical details for the course. We're starting, so we're running 5 weekends between October 2025 and April 2026 at the City College of Acupuncture in London. The early bird price finishes mid-August, and it is £1,650, including the online lectures and the 5 weekends. After that, it will be the full price of £1,750.